Good afternoon and welcome to our Sunday daily briefing of COVID-19 here in St. Clair County. I'm joined with County Board Chairman Mark Kern and Samantha Bierman from the Health Department. Sam, you have today's numbers for us.
I do, and today's numbers are pretty good. We're going to keep our fingers crossed that they continue down this road for the rest of the week. So as of today, 7,201 tests have been performed in St. Clair County with 1,230 positive test results, which is an increase of 13 from yesterday, and that does include both males and females from their teens up to their 70s. We are at 5,907 negative test results, with 64 test results still pending. We do have one new addition for death that we are reporting today, which takes our total up to 96, and that was a female in her 90s who did have underlying health conditions, and as always, our condolences go out to her family. For those that have completed the IDPH required 14-day quarantine, we are at 796. And for state totals, 877,105 people have been tested, with 120,260 positive test results, which is an increase of 1,343 from yesterday. And we are at 5,390 deaths for the state, which is an increase of 60 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 62 people that are admitted due to COVID-related reasons, and 3 of those patients are on ventilators. For congregate living facilities that are in outbreak status, and that is having 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Berea of Belleville has 26 cases and 3 deaths. Berea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Caseyville Nursing and Rehab has 3 cases and no deaths. Cedarhurst of Shiloh has 11 cases and no deaths. Cedar Ridge of Lebanon currently has 5 cases and no deaths. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 23 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon currently has 53 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 39 cases and 39 cases and 3 deaths. St. Paul's Home in Belleville has 40 cases and 11 deaths. Swansea Rehab and Care Center has 11 cases and 1 death. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And I will turn it over to Chairman Kern.
Thank you, Sam. Like to hear those numbers. Keep that going now. We don't want you to get blamed if there's an increase this week. So we'll move into the zip code report right now. We don't have any new zip codes today. That's a good thing, but we do have some changes in some zip codes. Remember, if you don't hear your zip code, it doesn't mean there's no one in your zip code that is COVID positive. What it means is the level of COVID positives has not risen above the number 5 yet. So in 62059, once again, we remain the same at 7. 62201 remains the same at 16. In 62203, we increased by 1 to 43. In 62204, we remain the same at 45. In 62205, we remain the same at 46. In 62206, we went up 1 to 106. In 62207, we went up by 2 to 73. In 62208, we went up by 2 to 77. In 62220, we went up by 1 to 139. In 62221, we're at 107. That number remains the same. In 62223, we remain the same at 48. In 62226, we went up by 1 to 136. In 62232, we went up by 5 to 26. In 62239, we remain static at 15. 62243 remains the same at 8. 62254 is also the same at 34. 62257 is the same at 11. 62258, once again the same at 17. 62260 is the same at 7. 62264 is the same at 39. 62269 went up by 2 to 72, and 62285 went up by 1 to 14. So today's question answer day, and I guess, Brian, have you got the list?
I've got a couple pages of questions here that were submitted that we'll go through. Some of them are continuing of stuff we've talked about several times in the past, but always good to have a little refresher and make sure nothing has changed. But some interesting questions that came in today.
Great. Well, let's get going.
So, Sam, the first question came in was, can you be exposed to COVID-19 even if you're wearing a face shield?
So the answer to that is yes. There is no 100% way to completely protect yourself from COVID-19. While wearing a mask is a very good step in the right direction, you could be wearing a mask and could have touched something that has been contaminated with your hands, and when taking off your mask, still be, have your hands contaminated and then touch your face. So while wearing a mask is a great step in the right direction, unfortunately right now there is nothing that we can say is 100%, effective in keeping you COVID-free right now.
Okay. Next one says, I was wondering if you could report how many non-COVID deaths St. Clair County has each day, or if you could tell us how many we had for the similar time frame in the past few years.
Well, the numbers that we report and are reported to us daily for these briefings are those that are COVID-related deaths. If you have any questions about normal deaths that happen in St. Clair County, you can reach out to the coroner's office. That is public information, and I do believe they post that on their county page as well.
Correct, on their website.
On their website on how you can find out information about deaths, because that is public information. But for the daily briefings here at EMA, that is not reported to us.
So, and I know the Illinois Department of Public Health is looking at this number, and it's going to take it's very preliminary now.
Mm-hmm.
They're calling that excess deaths. So that is the number of deaths that might not have occurred had it not been for COVID-19.
Mm-hmm.
So just generally, they're saying that there was, and this is just a spreadsheet that was put together, that there's an increase of about 18.5% of the deaths that have happened in St. Clair County since that time are considered perhaps to be excess deaths. They're going to have to go back and study, study the number and take a look at what people died of and examine all this, in the light of having a lot more data, a lot more history behind them. But they say at this point, and this was a website that I read, that they think that St. Clair County has had 77 more deaths than we would have at this time because of COVID.
And as with a lot of our county departments right now, the coroner's office is also working, pretty hard. Their work levels have increased since COVID has started, and we've been working hand in hand with them to make sure that we're reporting the most up-to-date numbers for those that are COVID-related deaths.
Right. So it's certainly something that Illinois Department of Public Health will come out with, this statistic at some point after all this is over, and after we're sitting on our porches drinking a Mai Tai on some Sunday.
On Sundays, yes.
We'll be able to read that article.
Well, Sam, while we're talking about deaths, another question that came in was, can you discuss when you say this person, as in today you announced that there was a 90-year-old female that passed with underlying health conditions. What is classified as an underlying health condition?
So that could be quite a range of things. Just a few off the top of my head, that could be if you have any cardiac conditions, any heart conditions, if you're a diabetic, if you have high cholesterol, if you have high blood pressure. The options are pretty endless depending on the individual and their health, but it could be a wide range of other health conditions.
But as you've reported here before, if someone dies in a traumatic event such as a car accident or a homicide or a suicide, regardless of whether or not they're COVID positive, they would not be included in.
That is correct. I believe it was about a week and a half, 2 weeks ago, Dr. Ezike from IDPH had made that clarification on one of the governor's briefings that if you did die of suicide, car accident, homicide, of a situation like that, and you happen to be COVID positive, you would not be attributed as a COVID-related death.
So essentially, when you talk about an underlying condition, they have something that could have caused their death that might have been aggravated by COVID-19.
Correct, and that had been present before COVID-19 became one of their diagnoses.
Okay.
Correct.
Very good. Chairman, a couple that have come in here for you. One question kind of talks about, maybe the courthouse and operations here, but about marriage. The person wrote, I'm getting married in July. Do you think it would be safe enough for me to hold a small wedding of about 25 people?
So we just moved into phase 3 on Friday. If we maintain the metrics that we are now, and from all appearances, we are headed in that direction. June 26th, I believe, is when we would move into phase 4. At that point, gatherings of 50 or less are allowed. So I think you picked the right month to get married. It appears, as of right now, we should be headed into phase 4 by the end of June. So July should be safe.
Okay. Another one where we're talking about that. I know this is one we've discussed in the past. When will public swimming pools and public playgrounds be allowed to reopen?
So the guidance hasn't been issued for that yet. They're not part of phase 3. So I guess we'll just wait to see, and they're really not even part of phase 4. We'll have to wait from the guidance from IDPH to know when it's safe to reopen.
And we've been working with some of the municipalities here in the county, and we have requests under the Department of Commerce and Economic Development specifically about that swimming pool question, because we do have some of our municipalities trying to make those decisions of, okay, do we think it's going to be included in the next phase? Should we plan ahead? Because opening a swimming pool for the public is obviously not something that happens overnight. So we're definitely monitoring that, and we'll provide any updates as we get them.
And the playgrounds, the main thing they're talking about is the equipment that all the kids touch. Our parks are open, ready for use, and have been really throughout this. We never closed our parks in the county. We always felt it was important to give people a place to recreate.
Absolutely. Okay. Sam, a couple more that came in. Something we talk about every day. Question is, how many people have recovered from COVID-19?
That's the question of the hour. So while we, for our briefings here at EMA and for St. Clair County and St. Clair County Health Department, we do not use the term recovered because depending on the individual, recovered could have many different definitions and different meanings. But what number we do give you is those that have completed their IDPH required 14-day quarantine. And today that number was 796.
And I think something important to note that as people look through it and monitor all these stats, one thing the state started reporting on their site was that they're seeing most recoveries occur at day 42 and beyond. So while we look at a person that might be 14 days from their quarantine period and not expected to be shedding virus to contaminate others, there's still a significant recovery process. And if you have some of those underlying conditions that you mentioned, those people might take even longer.
Exactly. Depending on what their health status is before they became sick with COVID, that could stretch out those, possibly 1 or 2 symptoms that are still lingering for an extended period of time.
Very good. Another one that came in, when we talk about long-term care facilities, it says, have there been any cases reported at the community of Our Lady of the Snows?
So the Our Lady of the Snows, and they're specific when at the Dammer Retirement Center is what they call it. They have not been listed on our outbreak status, which means that they do not have 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. If they get to that point, and just so everyone knows, St. Clair County Health Department does reach out to all of the long-term care facilities that are in the county, as well as congregate living facilities daily to check to make sure that there are no new updates, positive test results, negative test results, and unfortunately, if any deaths have occurred for a resident of their facility. So we get that information daily.
Okay. And I think it's important that you mention that process that you guys go through daily, because we get a lot of questions about, well, we see on the state website it's only showing this and you guys are showing more. We're actually reporting those on a daily basis, where the state is only updating their information once a week.
Once a week, and a lot can happen within a week. And you will see on Illinois Department of Public Health's website that they say their numbers are provisional, which means that they could change. And we found it important enough to, assign those responsibilities of calling our long-term care facilities to members of our health department staff daily, so we can make sure that we are reporting the most up-to-date information when we do these briefings.
Okay, thank you. Again, another question that we've talked about before, but it's asked, so we'll revisit it. How long can a person be asymptomatic with COVID?
Well, that could, I don't know that question can be answered right now. Everyone is different. Everyone handles COVID different. As we have said in the past, you could be completely asymptomatic, have no symptoms of COVID, be feeling fine, but if you happen to be tested, could be tested positive for COVID. So that's not an answer. We've said before that for some of these medical questions, we're not doctors. We have brought some physicians on the briefings before to answer those questions. But right now, I don't even know that the physicians could answer that, because COVID is still something that is rapidly evolving and changing, and they're still learning about it every day.
Okay, thank you. Chairman Kern, we've talked a lot about the Restore Illinois plan, and you mentioned earlier that we're on target to move possibly to phase 4 in June. The question came in here. It says, what if the numbers get terrible in Region 4, which is the IDPH region that we're in, but Region 5 doesn't seem to have any problems? Do you think they will split and separate us to allow us to stay, I don't want to call it penalized, but stay more restricted than the other part of the southern region?
It's hard to deal in conjecture. What I would say is it seems that the Restore Illinois plan, I know the Illinois Restore plan was put together by medical professionals. If there would be some terrible spike for some reason in this individual district, there may be a change. I don't really foresee that. I think there's a reason why they combined Regions 4 and 5, which is us, and made that the southern part of Illinois that would be added together then to reopen. I don't really see this happening, but of course, anything's possible, and when you're dealing with conjecture, I guess everything is possible. I just don't see that happening.
Well, and while we're on the topic, the next one that came in that says, what would the conditions need to be in order for us to move to the next phase, being phase 4?
So the good news is that, here we are 2 days into or past going to phase 3, and we've already met 2 of the days of the 28 that we need to go into phase 4. Basically, we keep our numbers below 20%, the positives, like we've been doing every day, keep those hospitalizations down, and then be able to have that capacity of ICU beds available. And we're going to meet that number and be able to go into phase 4. So far, so good. Numbers are looking like they're remaining constant. So hopefully we can look forward to reopening the end of the month on the 26th.
Very good. Sam, a couple more that came in here, and this is again something we've talked about a lot, but I think it's important to continue talking about it. It says, we keep hearing about we need to get tested. It sounds like you're advising everyone, even without symptoms, should be tested. Mm-hmm. If that's the case, why are we telling people that?
So we've been seeing a growing number of people that have been going out to get tested that have no symptoms, that are asymptomatic, are coming back COVID positive. And the reason we're urging everyone to go get tested is, even though you feel fine, you could test positive, and without knowing it, you could be passing along COVID to someone else. So we're urging everyone to get tested, so even if you are positive, we can have you complete the quarantine that's necessary to protect yourself, to protect those in your household, and protect everyone around you.
Well, and while we're talking about that, I think it's important to remind our viewers that COVID testing is available at multiple locations throughout the county.
It is.
It is free.
It is.
And there are sites that don't require any type of symptoms, any type of essential employment status, any type of vulnerability. You can just go get tested.
The Walgreens in Cahokia, you don't have to have an appointment. As Brian said, you don't need to have symptoms. You don't need to have insurance. You can drive up and say, I would like to be tested. They test you, and most of the time, depending on the time of day, you get your results that same day. So it's a very quick turnaround time and a pretty easy process.
And the state testing site at
Jackie Joyner,
the turnaround time for the test is a little longer, but
it is.
It's the same process.
Exactly.
Drive through. You don't even have to. Initially, they said they were going to be asking for insurance. They don't even ask for insurance.
Mm-hmm. Yeah, you, again, the Jackie Joyner Kersey one, I believe, and correct me if I'm wrong, you park and you get up and walk to one of the tents.
I think you drive through.
Oh, it is a
You
drive-through,
never
okay.
get out of your car. You roll down your window a little bit. You show your ID so they can get the address of where to send the results, and pretty much you stay in your car. They hand the kit in. You give yourself the test, which is basically a swab that you just kind of touch inside your nose and twirl around to get a little bit of fluid on it, and then you put it back. They give you a tube at the Jackie Joyner site to put your swab in a tube of liquid, because then they send it to the state lab.
So yeah, just as easy as the Walgreens, it sounds like.
You drive away and wait for your results.
There you go. But yes, we are urging everyone to get tested, simply because we're seeing a higher number of people that are showing no symptoms coming back with COVID positive test results. And, we're just trying to keep the number of positives as low as we can, hoping to keep flattening that curve. And by testing everyone, we can keep those that need to be quarantined, and, protecting those around them.
Okay. Here's another one to come in. It's kind of a two-part question. Okay. First part of it says, how many zip codes are in St. Clair County? Then it says, plus I heard on one of the governor's briefings that there are some private nursing homes that aren't testing and the state is being forced to step in. Is there any truth to that, and how many of those are in our county? Continuing, I would like to say thank you for answering these questions every week and keeping us all informed. I appreciate the dedication and hard work.
Oh, well, that's very nice. Thank you. Thank you for that. So for St. Clair County, we have 38 zip codes that are within the county. And just this past week, Illinois Department of Public Health passed down some new requirements for any long-term care facility or congregate living facility that gets CMS reimbursement, which is they accept Medicare or Medicaid. They are now being required to test all of their residents and staff for COVID. And we have actually already started this process, and we are underway with testing all of the long-term care facilities and congregate living facilities within St. Clair County. We've tested a handful so far, and we're continuing to make our way down the list so everyone gets tested, and we can keep all of those residents in those facilities, because as we've said, those people are in there most of the time because they have some underlying health conditions, and they are the most vulnerable. So not only with their age risk factors, but with their prior health risk factors, we want to get them tested and their staff tested so we can keep them safe and healthy.
Okay, thank you. One more question for you, Sam, here is there any way to discuss how many people are recovered, or as we're referring to it, completed that quarantine by zip code?
So because the recovery varies by each person depending on the situation, if they have, underlying health conditions or whatnot, it's hard to give that number because that's not something that can be reported, because as we've said, we report the number of people that have finished their 14-day quarantine, not necessarily that recovery period, because that recovery period could span many weeks, like you said, almost a couple months sometimes, depending on the individual.
Okay, thank you very much. Chairman, a couple more that came in here for you as we wrap up the list of questions that came in here today. And this one kind of goes with one we just talked about with Sam and your zip code report. And the question was, are the nursing home numbers included in your zip code report?
So the nursing home numbers are made up of the people who live in the nursing home, and those people, their diagnosis is reported by that zip code where the nursing home is. The other people that are included in that number are all the people who work in the nursing home. Their numbers are reported to the zip codes where they live, where they reside. So, and really it's a surprising number when we hear the numbers that come back from some of these care facilities that, a percentage of the staff is COVID positive, and so those numbers would impact a zip code had they been reported at the nursing home zip code or the long-term care facility zip code. But no, they're reported in the zip code where they reside.
Okay. Question, we had this one asked 4 or 5 different ways, so I'm going to try and just put it together here. And the ultimate question is there still a requirement to wear face coverings in public?
There is. People should wear a mask when they go out, when they're closer, when they're going to be in a situation they can't control, where they're going to be closer than 6 feet to another person. It's not just the requirement, but it really is smart. It helps you because others will be wearing the mask and they won't be transmitting it to you. And you, who might be have asymptomatic and not know it, it'll keep you from transferring that to someone unknowingly and unwittingly. We know people wouldn't want to do that, and the way to be safe and to not do that is to wear that mask.
Well, and I think one of the important things to talk about that, when you look at that CDC guidance that talks about wearing a face covering in public, it specifically says that that face covering is not meant to protect you from other people. It's really meant to protect the other people from you. It's meant to hold your droplets in to keep them from going out to other people, short of like an N95 type respirator, something that's used in the hospital setting. Those are what's really designed to keep anything from coming through to you. But there is some good guidance and some requirements that the people have followed. And we do see good compliance from the business industry and a good majority of the public. Now, there are some that if they can't medically tolerate it or if they're below a certain age, but all in all, most people are heeding that advice.
I think so. People are trying, and the best thing to do is just keep it in your car. Keep one. I keep one in my checkbook in my pocket, in my back pocket. Just fold it up, just in case, because a lot of times you run to go to the store, you have an errand to do, and then you forget.
Hey, I'm here. I got to put a mask because it's not our normal behavior. Prior to 80 days ago, we weren't of any knowledge of putting on a mask to run into the store, and it definitely is something to keep on that forefront.
To try to get used to.
Here's a question that says, what if coronavirus never fully goes away? How will the county do things?
These questions.
I told you they're getting a little harder as we.
I know. Well, by all reports, it looks like vaccine is on the way. Most doctors that we've had on our program all feel that it is a treatable illness, and they think that means that it is something that can be prevented through a vaccine. So we're going to have to hope that that's the case. It looks like it's going to be, but we're a resilient people. We will deal with whatever comes along, but I fully expect that what's going to come along is a vaccine that's going to allow us to get back to the way we were before all this started.
Very good. And the last question, I believe we got them the answer they were looking for, but we'll make sure we include it here. It said, can you list how many cases occlude in each zip code? Other places do it, and I've been asking for a while and don't seem to get the answer. Well, I feel like you've been providing the zip codes every day. And
maybe they're watching another program, but we've been doing this for quite a while with the zip codes. And if there's something that we're not presenting, or if we're not presenting things in a way that you need to see them, although we're pretty far through this process now, we're always willing to improve things. So tell us what we're not doing and we'll do it right.
Okay. One more question came in, and Susan Sarfati's able to join us here today, in St. Clair County Superintendent of Schools.
Magic.
It's becoming a Sunday tradition because, as you know, everybody's got questions about the schools. And the question that came in today is kind of on a different side. This is about the educators. And today's question that was submitted said, is there any plan in place for educators that need to meet any of their training or technical requirements before the next school year, such as fingerprinting?
Well, first of all, as far as training, there are many things that are available online. The Regional Office of Education has some of our programs online, but you can find professional development lots of different places. And much of it is free, so that's a good thing. Fingerprinting, we will start fingerprinting on Tuesday. We'll start seeing anybody that needs to come into the regional office on Tuesday, but you have to make an appointment, much as what the county is doing at the courthouse. And to make that appointment, you go to our website, which is sccroe50.org.
And they'll have to wear a mask when they come visit you.
Masks are a requirement for the public and my staff who will be serving the public. Yes.
Okay.
All right. Thank you.
Thank you,
Again,
Chairman.
glad to hear you're reopening.
You too.
Well, Chairman, that meets all the questions that were submitted for today. Another good Sunday of questions and answers. And while they might not be the answers everyone's looking for, it's the best information we can provide, as has been going on for several days. As Herb Simmons would say, he's not here with us today. He'll be back with us tomorrow. But he would thank everyone for joining and being a part of Team St. Clair, heeding that advice, heeding the warnings that are given, and making that responsible and safe decision for yourself and for your family. We'll be back tomorrow at approximately 3:30 with our daily briefing, and be back in just a few minutes with Cindy and Daisy, who will translate this to our Spanish-speaking communities. Thank you for joining us.